Welcome back to my channel. My name is Sanida. Today I am going to discuss about OET Reading Part A. In OET Reading Part A, it is very important to complete 20 questions within 15 minutes period. I repeat once more, you have to complete 20 questions within 15 minutes period. Okay. So how can you achieve 20 out of 20 in OET Reading Part A? It is very important to get 20 out of 20 marks in OET Reading Part A. If you are not getting 20 out of 20 marks in OET Reading Part A, definitely it will reflect your score in OET Reading session, So many students are working very hardly and they are repeatedly writing OET reading modules, only OET reading modules, but they are not tracking OET reading session. Why it is happening to our students? So it is one question we have to find out. Okay, so before going to give you some information about OET reading part, it is very important to try. It is very important to understand the type of questions in OET reading part. It is very, very important. Okay, so try to understand the type of questions and try to understand the meaning, what it is actually asking. If you are not understand the question, it is very difficult to find out the answer. Okay, so you will get one question. There will be one or two clue words are there, keywords. Okay, there will be keywords are there. These keywords will approach you to find out the answer. Okay, if we are not getting the keywords in the passage, definitely your answer is not there. Okay, this is 100% sure. So it is very important to underline the keywords. Okay, I repeat once more, why you people are not getting 20 out of 20 in OET reading part A session. You are not underlining the keywords. You are not underlining the keywords. We are human beings. Okay, we are human beings. Sometimes we forget. Okay, so you have to underline the keywords. Keep it in your mind when you are approaching the answers in the passage. Okay, got it? Okay, if your keyword is not there in the passage, your answer is not there. If you are searching again there, it is waste of time. Your time will gone. You won't get correct answer. Okay, you won't get answer. The time you won't complete your 20 questions within 15 minutes period. That is very important. Okay, please try to understand the question and try to underline the keywords and find out the questions in the passage with the help of the keywords. Okay, you got it? Okay, second, okay, there is no need to read the passage, whole passage. There is no need to read the whole passage, okay. There will be four texts, text A, text B, and C, and D, okay. So you have to understand text A, what it is saying, okay. Maybe this is saying about this is psoriasis, okay. It is text A is saying about the psoriasis condition, okay. And text B, just you have to underline the headings, okay. Text B, it is saying adult psoriasis, especially given adult psoriasis, topical treatment pathway. There will be some ointments, topical treatment pathway. There, what are the topical tongue and limbs? And there are some two headings, tongue and limbs and face and pleasures. So these are the keywords, okay? Corticosteroids, vitamin D preparation. Just underline these words, okay? Just underline these words, okay? Thus, see, just within 1 minute, you have to complete this task, okay? Just see some points, nouns, psoriasis, arthritis. These are the points, just you have to underline, okay? So, CASPR, okay? So, some points are there highlighted. These points you have to underline. There is no need to read all the topics, okay? It will be waste of your time, okay? So, D, children and young people. Okay, so their treatment is given of children and young people, creams, steroids and non-steroids. Okay, so vitamin D analogs to prescribe some medications also given. So we will get some idea. try to read these headings, we will get some idea what the test is saying about what is test is saying, what are the points will be in this session. Okay, you will get some idea. Then within 1 minute, you have to complete this process. Okay, so then you have to, now you are going to approach the question. Okay, it is my humble request. Don't try to do 1 to 6 question in the first session. Okay, that is very important. If you are trying to complete 1 to 6 questions in the first section, it will be a waste of time. Okay, but maybe if you are good in English, it's okay. It's okay. If you are good in English, 100% sure, it's okay. No problem. I'm not forcing. Okay, if you are not, okay, if you are a beginner or intermediate level, try to do 7 to 20 questions in the first section. Okay, try to do 7 to 20 questions in the first section. Okay, it is clear. Okay. Now we are going to do the first session. Okay, so seventh question. Okay, in addition means they are going to say something else. In addition to the arms and legs. Okay, in addition to the arms and legs, these are the keyword. If they are special, in addition to the arms and legs. Okay, this is the keyword. Okay, which areas they are? This is the which area they are asking some area. Which area this is, and which area of the body is most likely to be affected by chronic plaque psoriasis. Okay, chronic plaque psoriasis. Okay, chronic plaque psoriasis. These are the points. What are the points? In addition to arms and legs, which area most like which area to be affected? Chronic plaque psoriasis. Just underlining the question, definitely you can understand the questions. Okay, so what the question is asking now. So we have seen here part A is about psoriasis. Okay, got it? About psoriasis. Part E, adult psoriasis, a topical treatment. Okay, topical treatment, and thus is psoriatic arthritis. Okay, and CASPR categorization. Okay, and fourth is children and young people psoriasis topical treatment part A. So when you read the question, you have to understand where I have to check this answer. Okay, so there it is asking about chronic plaque psoriasis. So definitely this answer will be in the part A session. Okay, so we got. What are the points we have to find out? Arms in addition to arms and legs. Something is saying yesterday. In addition to arms and legs, which area mostly affected chronic plaque psoriasis? Okay, so we have to skim and scan. Okay, chronic plaque psoriasis is the main noun. Okay, chronic plaque psoriasis. That is the main keyword that we have to find out. Okay, chronic plaque psoriasis. So you have to you have to skim and scan. Okay. Chronic plaque psoriasis. Okay. Diagnosis of here the first one is chronic plaque psoriasis. Diagnosis of cutaneous psoriasis is usually straightforward based on the clinical appearance. The most frequent presentation is chronic plaque psoriasis and is characterized by well demarcated bright red plaques covered by recurrent silvery white scales. This may be affect any body side, often symmetrically, especially the scalp and extended surface of limbs. Okay. So what are the keywords? One of the keyword is chronic plaque psoriasis. Second keyword is arms and legs. Arms and legs, we got surfaces of limbs. What are the limbs? Upper limbs and lower limbs. Okay. We got, okay. In addition to arms and legs, which area? That is the question. In addition to arms and legs, which area is affected? In addition, okay. especially the scalp and exterior surface of the limbs. Okay, so the limbs already given. In addition to limbs, which area is affected? The scalp. Okay, got it? What is the answer here? The scalp. Okay, this is the way you have to find out the answers in OET reading part A session. Got it? Second, in what age range, this is important, age range, does PSA, psoriasis, arthritis, PSA, typically develop in patients with psoriasis? So what are the keywords here? Age range, PSA, typically develop in patients with psoriasis. So we have to check where the this PSA is given. So definitely there is given some age, right? So that will be there. You will get the answer. Okay. So you have to go to PSA. Where we got PSA? We got here. Okay. Then the age range. In what age range does PSA typically develop in patients with psoriasis? Okay. So PSA may develop at any time, but usually presents between 30 to 50 years of age. What is the question here? In what age range? The range of the age is given. It is 30 to 50 years. So you have to write 30 to between. So you have to write the age range is asking between 30 to 50 years. Okay, got it? Next question. When treating psoriasis, with very potent corticosteroids, this is another noun. Okay, you have to underline potent corticosteroids. How long should be left between course? Okay, how long should be left between courses? Okay, when treating psoriasis with very potent corticosteroids, how long should be left? That is a how long is the another keyword. That is the question. How long should be left between the courses? Okay, so psoriasis, potent corticosteroids. These are the keywords. Potent corticosteroids. Okay. So where will be the potent corticosteroids? Here we got potent corticosteroids. Potent corticosteroids. Okay. What is a when treating psoriasis with very potent, so very potent corticosteroids. That is the keyword, very potent. Okay, here it is potent corticosteroids, potent corticosteroids, potent corticosteroids, potent corticosteroids. See here, very potent corticosteroids. Here, the aim for a break of 4 weeks between courses of treatment with potent or very potent corticosteroids. Okay, so here it is given only potent corticosteroids, but the keyword is very potent corticosteroids. See the difference, okay? So you have to find out the keyword like that, okay? Don't simply jump into the, you have to underline the full keywords, very potent corticosteroids, okay? Got it, very potent corticosteroids, okay? So the answer is here we got very potent corticosteroids. The difference when treating psoriasis with very potent corticosteroids, how long should be left between courses? How long should be left? Aim for a break. Left means break of 4 weeks between courses of treatment with very potent corticosteroids. Okay, got it? What may be prescribed? What may be prescribed as an alternative to coal tar preparation? Alternative. That is the question. What is the alternative to coal tar preparation? Okay. So coal tar preparation. Here we got alternative is also we got here. Dithanol could be considered as an alternative to coal tar preparation. So all the keywords are here. We got the answer here. Okay. Next. How much a non-steroid cream? Here another keyword, non-steroid cream should be prescribed for application to a child's trunk. Okay. Here the child's trunk is the question. Okay. So that we have seen in the text D. Okay. So the question is child's tongue, non-steroid cream, how much non-steroid cream should be prescribed, or how much child's tongue. Okay. No, this is steroid. Non-steroid, how much it will be? 400 gram. Okay. Non-steroid keyword is here. Okay. How much tongue is here? Okay. Child's children here. Okay. Got it? What is the maximum amount of calcipotriol, okay, calcipotriol to be prescribed to a 13-year-old per week? That is 13-year-old here again, child, okay, children, okay, 13-year-old per week, okay, maximum amount of calcipotriol, that is calcipotriol maximum amount over 12 years means 13-year-old per week. That is 75 gram weekly. What is the answer here? 75 gram weekly. Got it? All the keywords are here. Our answer is also there. Okay. Easily, very easy. Part is very easy. Don't be make it very difficult. Okay. So try to understand the question. Definitely you will get the answer. Okay. Definitely try to underline the keywords. Keyword is very important. I'm telling you, keyword is very important. Okay. If you are not trying to understand the keyword, you are not going to get the answer. Okay. That is 100% sure. Because of my experience, I'm telling you, we are not getting the keyword in the passage, your answer is not there. Don't waste your time again searching here and there. Don't waste your time. Try to find out your keywords. Okay. Definitely your answer is there. Okay. What should be prescribed for a patient with facial psoriasis? Facial psoriasis which doesn't respond to moderate corticosteroids. So what are the keywords? Facial psoriasis, moderate corticosteroids. What should be prescribed? What should be prescribed? Okay. Facial psoriasis. Okay, so face, pleasure, and genitals. And the keyword is moderate corticosteroids. Moderate corticosteroids we got here. Okay. Then under the question keywords, what should be prescribed? What should be prescribed? Once or twice daily, mild or moderate corticosteroids. Okay. Up to a maximum of 2 weeks. Discontinue if unsatisfactory response or continuous treatment required to maintain. If it is unsatisfactory, we have to say calcineurin inhibitor. Okay, so then we have to move forward what they are saying again. Okay, if it is unsatisfactory, we have to move forward what it is given there. Okay, so the answer is calcineurin inhibitor. Okay, got it? What is the maximum percentage? That is, and the there here asking the percentage of a young patient. For young patient and children, where we have seen we have. So here it is young children and young. But definitely your answer is there. Okay, so we already know what are the percentages it is saying. Okay, so what is the maximum percentage of a young patient's body to which calcitrol, another keyword calcitrol may be applied? Okay, maximum percentage. There it is asking the percentage. Okay, so calcitrol maximum percentage, not more than that. That means maximum is 35%. Okay, got it? This is the way you can find out the answer. Okay. Next, we are going to approach the fill in the blanks questions. Okay. A patient with a fever in addition to pustules. Okay, fever is already there. In addition to pustules, plaques and red skin may be suffering from. Okay, maybe suffering from what condition? Okay, so in addition to fever, patient, what are the conditions? Pustules, plaques and red skin. Definitely this answer is in the first section. Okay, that's A. In addition to fever, that is pustules, that we have to find out. Okay, in addition to fever, pustules, red and center skin, associated with fever. Okay. Okay. Pustules is also, we got here. What is the question? A patient with a fever, in addition to pustule, plaques, and skin, may be suffering from what is the condition? Okay. So, generalized, we have to read the sentence. Generalized pustular psoriasis is a rare and is characterized by the development of multiple sterile non-follicular pustules within plaques of psoriasis or non-red tender skin. This may occur acutely and be associated with fever. So all the keywords we got here, what is the condition? Generalized pustular psoriasis. Okay, generalized pustular psoriasis is the condition. Okay, what is the answer? Generalized pustular psoriasis. Okay, general pustular psoriasis. Okay, so there is a less. Less is another keyword. Less dash of the skin if the patient has palmoplantar psoriasis. This again, it is in the part A. This is talking about palmoplantar psoriasis. There is a less dash of the skin. Okay, so go to part A. The keyword is here, palmoplantar psoriasis. Okay, so we have to find out palmoplantar psoriasis. Okay, palmoplantar psoriasis. See, palmoplantar disease. Okay, skin and in palmoplantar disease. Okay, there is LS. That is another question. Okay, scaling is reduced. Reduced means less. Okay, synonyms, paraphrase. Okay, scaling is reduced at fleshocytes on genital skin and in palmar, so palmoplantar disease. So scaling, what is the answer here? There is less reduced scaling of the skin if the patient has palmoplantar psoriasis. Okay, got it? There is a less scaling. Okay. The CAS, so the keyword is here, given the CAS PR criteria should be applied to patients who are already diagnosed with. Okay, that is the keyword CAS PR and already diagnosed with. Okay, so we have to go to CAS PR. Okay. See, CAS PR already a patient must have means already diagnosed or must have inflammatory articular disease and greater than or 3 is equal to greater than or is equal to 3 points from the following criteria. Okay, the point the CSR criteria. What is the question? If the CSR criteria should be applied to patients who are already diagnosed with what? Already a patient must have inflammatory articular disease. Okay, already a patient must have means already diagnosed, must have. Patient have already have inflammatory articular disease. Okay, what is the answer? Inflammatory articular disease. Okay. Next, poor formation of the under keyword of the dash, including fitting, can indicate PSA. Okay, so the keyword here PSA, poor formation, including fitting is under keyword. Okay, so we have to get PSA. PSA. PSA is talking about in this passage poor formation. Poor formation. So we have to scan it. It is like a skim and scan. Okay. Poor formation. Poor formation. That is the keyword. Poor formation. Sorry, is present. See here the pitching we got here. Okay, poor formation. Psoriatic nail dystrophy. Dystrophy means dystrophy is the another keyword. Dystrophy is the poor formation. What is the psoriatic nail dystrophy? What is the answer here? Poor formation of the nails, including description, what it is given, pitting. Okay, so the keyword is here, including, can indicate PSA. Okay, the passage is talking about the psoriatic arthritis PSA. Okay, so indicate PSA. What is poor formation of the nails, including pitching, can indicate PSA. Okay. Around half of the patient means agar half of the patients, if it is 100%, then 50%. Half of the patients with PSA, again, with the keyword is we got PSA, will have pain in the dash joints. Okay, so PSA, here we are told PSA, half of the patient, that means half means 50, is affecting. Oh, see, directly we are getting everything. Okay, around half of the patient with PSA will have pain in the dash joints. Pain in the dash joint. So we have to read on physical examination, affected joints may have symmetric stress pain, joint line tenderness, and effusions with approximately 50% of cases affecting distal interphalangeal joints. Okay, what is that? The distal interphalangeal joints. Okay. The pain in the distal interphalangeal. Okay, you have to write distal interphalangeal dot joints. Okay, that is a distal interphalangeal. So the last question you are going to find out the answer. Okay, if a psoriasis on the flushes of psoriasis on the flushes fails to respond to a mild corticosteroids within dash, the treatment should be stopped. Okay, so if psoriasis on the flushers, okay, that is a keyword, fails to respond to mild corticosteroids within dash, within some period, within some time periods, dash, treatment should be stopped. Okay, so I will show you the place where you will get the answer. Okay, flushers we got here. Okay, within, and the another keyword is mild corticosteroids. Mild corticosteroids, another keyword we got here. Okay, within dash, within, okay, applied here within dash. What is the answer? Please message me on my description. Okay, comments box. Okay, please, what is the answer? Here you will get the answer. If you are watching my video, you are watching my video, I am going to post here. Okay, find out your answer. What is the answer? Okay, so the question I will repeat once more. If a psoriasis on the flushes fails to respond to a mild corticosteroids within that, the treatment should be stopped. Treatment should be stopped. Okay, discontinue. Treatment should be stopped, discontinue. These are the everything I have given. Just you have to write the answer. Okay, got it? Okay, this is the short short answer. Sorry, fill in the blanks question. Now we are going to find out the multiple choice question very easily, within second you can find out the 6 questions. Okay, so how much psoriasis ointments is required for various areas of patient's body? How much psoriasis ointment is required? So definitely the only here it is saying about how much we have to apply, if it is steroid or not steroid, how much we have to apply. It is given with the test D. Okay, so you will get definitely D. Okay. What the skin of a patient with psoriasis looks like. Definitely psoriasis, talking about psoriasis, all about psoriasis. So the answer will be in the part A, how much it looks like. So, okay, psoriasis, okay. Diagnosis is usually straightforward. So it is all about psoriasis, how it is looks like. Okay, so silver is white scale, plaque, red plaque, everything it is given. Okay, so the answer is part A. Okay, so the way of determining whether a patient has psoriatic arthritis. Psoriatic arthritis is given in the text C, psoriatic arthritis. So how it is determined? So it's a CASPER treatment. So the answer is C here. Okay. The consequence of not treating a disease with patient with psoriasis may go on to develop. Okay, if it is not treating, may go on to the where you will get maybe you will think about part A, or maybe where you will get. Okay, so if you are down in the part A, you can go there. If it is not there, the keyword, you can go to another session. Okay, so the consequences of not treating disease, consequence of not treating diseases. Okay, so where you will get. Okay, the consequence of not treating. Where is the answer? Okay, so the answer is in the part C. Okay, consequence of not treating the you will you know. Okay, the consequence of not treating a disease which patient with psoriasis may with not treating a disease which patients with psoriasis may go on to develop. Okay, so here categories is given negative rheumatoid factor dactylitis current on history record, rheumatoid record. So here currents or a skin of plague. See here, the PSA is characterized by pain and stuffiness in affected. If left untreated, see here the PSA could result in progressive joint damage leading to severe disability. So the answer is in the part C. Okay, got it? Prescribing vitamin D for adults with psoriasis. Prescribing vitamin D for adults with psoriasis. Okay. So vitamin D. Vitamin D, it is vitamin D here. Combination preparation is given here. Vitamin D preparation. So what is the answer here? B is the answer. Okay. So here is the C. Here is the B. Okay. I hope you got this answer in the part C. It is some difficult question. Okay. So, various conditions that may be confused with psoriasis. So, various conditions confused with psoriasis. It is in the part A session. Okay. So, the different diagnosis include eczema, tinea, lichen planus, and lupus erythematosus. The appearance of the plague may be modified by emollients and opportunistic scaling. Okay. Here differential diagnosis include. Okay, differential diagnosis include. Okay, various conditions that may be confused with the psoriasis. Okay, these are the condition not a psoriasis, eczema, tinea. These are not sorry. These are the differential conditions. Okay. So then what is the answer here? The answer is yeah. Okay. So this is the way you have to find out all the answers in part A session. I hope you understood the part A session. Please, I bless everyone to get 20 out of 20 in OET reading part A session. Okay. This is my ambition. Everyone has to pass. Okay. Everyone has to pass and get good marks in OET reading part A session. Okay. And today signing off, Sanida. Thank you for watching my videos till the end.